to treat cellulitis. Cellulitis is an infection of the skin that can develop when your skin breaks due to a cut, scrape, or injury and is exposed to bacteria. Streptococcus and staphylococcus are the most common types of bacteria that lead to cellulitis. Getting diagnosed. 1. Be aware of the risk factors. Cellulitis is a skin infection that usually occurs on the lower legs or shins. It's caused by the spread of bacterial infection, usually Streptococcus or Staphylococcus. There are several risk factors that make it more likely for these bacteria to find an entry point into your skin. 2. Look for these symptoms and signs. Cellulitis is most often noticeable as a red, itchy rash that begins to spread in an area where your skin is damaged. If you notice a rash spreading near a cut, burn, or area where skin has been broken, especially if it's located on your lower legs, it may be cellulitis. Look for the following symptoms. Coping with cellulitis. 1. Protect those around you. MRSA, methicillin-resistant Staphylococcus aureus, is becoming more common and is contagious. Do not share any personal items such as razors, towels, or clothing. Also, make sure that anyone who cares for you wears gloves before touching your cellulitis and before touching anything that might be contaminated. 2. Wash your cellulitis. Wash with regular body soap and water and rinse. You can then wrap a cool, damp cloth around the cellulitis to make it more comfortable. You should still make a doctor's appointment, but washing will help keep the infection from spreading. 3. Cover your wound. Until your skin scabs over, you need to protect the open wound. Apply a bandage and change it once daily. This will help keep you protected while your body is building up natural defenses. Treating and preventing cellulitis. 1. Take antibiotics. This is the most common treatment for cellulitis. Treatment depends on the severity of the infection and your health, but it usually includes a prescription for oral antibiotics that will kill the infection. Cellulitis should begin to retreat within a few days and disappear altogether within 7 to 10 days. 2. Get treated for severe cellulitis. In extreme cases, when the cellulitis has advanced deeper into the body, it may be necessary to receive treatment overnight in the hospital. Antibiotics will be administered intravenously or by injection to clear up the infection more quickly than if oral antibiotics were used. 3. Clean your wounds carefully. Cellulitis occurs most often when an open wound isn't properly dressed, leaving the skin open to bacterial infection. The best way to prevent this from happening is to take immediate measure to clean your wounds the second you get a scrape, cut, or burn.